Great, good morning. Welcome, everyone. I'd like to start by welcoming our guests. Fire Chief Joe Satilny of the Edmonton Fire Rescue Services. Thank you, sir. Lorena Gregg, the Executive Director of the Parents Empowering Parents Society. Dr. Nathaniel Day, the Medical Director of Alberta's Virtual Opioid Dependency Program. Police Chief Dale McPhee of the Edmonton Police Service. And Graham McAllister from Alberta Health Services EMS. And I am Mike Ellis. I'm the Associate Minister of Mental Health and Addictions for the province. So thank you all for being here today. Before I begin, I would like to take this opportunity to express my heartfelt gratitude to all Albertans, all of Alberta's emergency responders for their tireless efforts to keep our communities safe. This has been especially true during the last 2 years of COVID, as well as the staggering addiction crisis that our communities continue to face. As a police officer who worked the front lines for over a decade, I've worked closely with fire services, emergency medical services, EMS, and civil society organizations throughout my career. I know firsthand that first responders are in a unique position to help Albertans. First responders are not only trusted to respond to accidents, crimes, fires, and so much more, but they are a trusted partner in the community that Albertans can call upon in a time of need. There is no time of greater need than the current addiction crisis. The illness of addiction continues to have a deep and lasting impact on our communities. This is concerning and is not in any way unique to Alberta. It is evident that this is not a fight anyone can win alone, and it becomes more evident every day that we need all hands on deck. The recovery-oriented system of care that we are building brings together many different partners, including fire, police, EMS, civil society organizations. Addiction is a treatable illness, and with the appropriate treatment, recovery can and should be expected. Just recently, we have made significant advancements in our treatment capacity, and we have been hard at work eliminating barriers to a range of services. 2 years ago, we announced that we would be funding an additional 4,000 treatment spaces. 2 years ahead of schedule, we've doubled that commitment and funded over 8,000 additional annual treatment spaces. This means that over 8,000 more Albertans every year can access residential detox, treatment, and recovery services. We've eliminated all user fees for publicly funded spaces, which has dramatically reduced financial barriers for Albertans pursuing recovery. 2 weeks ago, we expanded the virtual opioid dependency program and began fully covering the cost of the injectable drug Sublocade for Albertans. Alberta is the only province in Canada to do so. Sublocade lasts in a person's system for 30 days, providing stabilization, reducing cravings, and significantly enhanced protection against overdose. This move has been described as a game-changing advancement in addiction medicine and is available to any Albertan regardless of their circumstances, same day, with no wait list, no matter where you live. So let me repeat that again. This is a life-saving treatment. It is available to any Albertan regardless of their circumstances, same day, with no wait list, no matter where they live in Alberta. Anyone can access this life-saving medication by calling the Virtual Opioid Dependency Program at 1-844-383-7688 or simply 211, and consulting with their expert team. In fact, thanks to the hard work of Dr. Day and his team at the Virtual Opioid Dependency Program, we're able to offer Albertans anywhere in the province access to treatment on demand. Police are also an integral part of social safety system, that they are an extension of the community. That's why last week, along with the chief of the Edmonton and Calgary Police, as well as the RCMP, I announced that anyone in these jurisdictions who is arrested will have the opportunity to begin medication-based treatment right from the municipal jail. We have also been expanding services that reach the 70% of Albertans who are dying at home. If you're using drugs at home, you can download and use the digital overdose response system or the DOORS app. It's free, it's secure, it's anonymous, and it could save your life by dispatching a medical response if you overdose. If you have a loved one at home who uses drugs, talk to them about using the DOORS app. It could save their life. To anyone out there who is struggling with addiction, know that treatment works and recovery is possible. All of these initiatives are about building a comprehensive recovery-oriented system of care for Albertans, a system of care that is built on the principle that no one should be left without hope for recovery, a system of care that treats addiction as a healthcare issue and makes recovery available every point in the system. Everywhere someone turns, recovery should be available and accessible to them. Our fire services respond on a daily basis to the wreckage of overdose calls. They do their best for us every day, but until now, they have been powerless to assist beyond the initial emergency. So that brings me to today's announcement. No one in Edmonton lives more than 4 minutes from a fire hall. And thanks to the help of the Edmonton Fire Rescue Services, people in Edmonton will now be able to visit any fire station and speak with a local firefighter about starting medication treatment for opioid addiction. Just show up and ring the doorbell. Firefighters in Edmonton will be able to immediately connect individuals with the virtual opioid dependency program right in the station. This will give people struggling with addiction another avenue to seek help and pursue recovery. As I mentioned, building a recovery-oriented system of care means that we need to give people options for when, where, and how they pursue recovery. This is another option for people to get connected with the expert team at the virtual opioid dependency program and to start life-saving medication like Suboxone and the newly covered Sublocade injection. But this initiative does not end with people struggling with addiction, as families also need support, and that is very important. That is why the Edmonton Fire Service and Parents Empowering Parents are teaming up to ensure that families also have the support that they need. When any family member comes to an Edmonton fire station, they will be connected with Parents Empowering Parents, in addition to receiving information about treatment for their loved ones. Addiction can have a devastating impact on families, as well as we need to ensure that they have the support that they need to start their own recovery. Parents Empowering Parents is playing a leading role in helping families pursue their own recovery from the devastating effects of addiction. Parents Empowering Parents is able to do this work thanks to an investment from the Alberta's government that helped them create the toll-free number for families to call them and find that support. That number is on the banner here beside me and can be called from anywhere in Alberta. You can also connect them by calling 211. They also offer professional support and other programs for parents and families. I encourage anyone who is struggling with a loved one's substance use to reach out to Parents Empowering Parents via their toll-free number, 211, or by visiting an Edmonton fire station to get connected with the resource. Alberta is grateful to have the support of our first responders in the fight against addiction. This illness requires a whole of the community. That includes all partners, including fire services, police, and of course, EMS. And that is what we're doing here today, and that is what we will continue to do as we move forward, building a system of care that ensures that everyone has the opportunity to pursue recovery. And with that, I would like to welcome our host, the Edmonton Fire Chief, Chief Joe Satilny, to the podium. Thank you, sir.
Good morning. As first responders, Edmonton Fire Rescue Services personnel work in partnership with EMS and EPS to respond to various calls, including overdoses, poisonings, and opioids. We have noticed a significant increase in the use of opioids since the onset of the COVID-19 pandemic, and to the point where naloxone is being delivered on average 3 times more than prior to the pandemic. Between fire and medical events, approximately 72% of calls during this last summer have been medical in nature, including opioid-related calls. To put it in perspective, in 2020, we responded to just over 2,400 overdose calls, and between January 1st and November 30th of this year, we've responded to more than 5,100 overdose calls. This increase in call volume diverts our resources from responding to other emergency events, and it continues to have a significant impact on those addicted, to their families, and to our first responders. This is why we are thrilled to partner with our fellow emergency services agencies and the Government of Alberta to help connect our citizens to addiction supports to prevent overdoses and take a proactive step to battle against this opioid crisis in our community. Protecting our community is why we go to work each day. Now, citizens who are in need of information can visit any fire station to access free pamphlets on Parents Empowering Parents support, the virtual opioid dependency program, the digital overdose response system, and more. When you visit the lobby of one of our fire stations to access these materials, we ask that you please wear your mask when entering a building in alignment with the COVID-19 health guidelines. If our firefighters are out on a call, they will be able to support you when you gather in our stations. Each life lost to an opioid addiction or drug overdose is a tragedy. In making our stations a safe place to get information for yourself and for your loved one is our hope that it will save more lives. Thank you. And I'd like to turn it over to Lorena for her comments.
Hello, my name is Lorena Gregg, and I'm the Executive Director of Parents Empowering Parents PEP Society. We are pleased to be a partner in this community initiative with Minister Ellis, Edmonton Fire Chief Zotelini, and his team of firefighters, and Dr. Nathaniel Day and his team at VODP. PEP is a grassroots organization that was founded over 17 years ago in Strathcona County. Today, in response to some funding from Alberta Health, we are a province-wide organization with a virtual permanent family recovery group, as long as in-person family recovery groups in the capital region and surrounding areas. We provide professionally facilitated, innovative programming to families, caregivers, individuals who have a loved one struggling with addiction. Along with our mission to provide education and support, we advocate for systematic change and engagement of the families and caregivers in the field of addictions and mental health. For many years, we have been advocating for a comprehensive, recovery-oriented system of care here in Alberta. I'm extremely happy to see the government supporting initiatives that help Albertans find treatment and enter recovery. This community initiative is a new and innovative approach. Addiction does not discriminate. It's not a respecter of age, gender, ethnicity, or status. It steals, kills, and destroys. It impacts all of us directly or indirectly. Our families, loved ones have experienced overdoses. Some have lived and some have not. It can be extremely destructive in families, as many of our parents have learned firsthand. Parents and family members will now be able to connect with Parents Empowering Parents by visiting any fire station in Edmonton. Our family recovery groups are available to you in person or virtually. This is in addition to our Alberta-wide toll-free family support number that you see here besides me on the banner. At PEP, we are here for you if you're struggling with a loved one and their addiction. Recovery is not only possible for the individual with addiction, it is also possible for the family. This is an open door that individuals and families can enter to be supported, valued, and find opportunities to step into recovery. I want to thank Edmonton Fire for their commitment to recovery and this initiative. To any family members out there who are struggling, you are not alone. Reach out and stay connected. Compassion, hope, and love for each other can change the trajectory of addiction and empower us to step into recovery. Thank you, and I will now invite Dr. Nathaniel Day to speak.
Thank you, Minister Ellis, Chief Zatilny, and Ms. Grigg. Today is another exciting day for addiction treatment in Alberta. The public know that they can trust emergency providers, like our Edmonton firefighters, to help them in a time of crisis. When I speak with families of people who struggle with opioid addiction, they tell me that timely access to care really matters. When a person is in crisis and is ready for change, we need to help them in that moment, not tomorrow, certainly not next week. The virtual opioid dependency program is well positioned to do this work and help Albertans anywhere in Alberta access treatment. Connecting with Edmonton Fire will ensure that more people can access life-saving opioid treatment medications. This initiative is part of a comprehensive recovery-oriented system of care that will save lives. All Albertans can be pleased with these practical and effective improvements to our system of care. Alberta's virtual opioid dependency program uses evidence-based medications to reduce overdoses, take away withdrawal symptoms, and reduce cravings. We connect people with treatment so that they can rationally decide what recovery looks like in their life, and so that they can decide what the next steps they need to take are in their lives. This partnership with the Edmonton Fire Department will allow even more people access to the care that they desperately want and need. If you or a loved one is using opioids, and particularly using opioids alone, I urge you to download the DOORS app in Edmonton and Calgary. It's anonymous, and it will connect you with professional emergency support services if you become unresponsive. If you are tired of the grind, just surviving on opioids, give us a call, 1-844-383-7688. Or visit your local fire station for more information. You can get professional, confidential, same-day help. We know that families affected by addiction face real challenges. I encourage any family impacted by addiction to reach out to Parents Empowering Parents to get support for themselves and ultimately for the person they love and worry about. Thank you.
Thanks, everyone. We'll now take questions from media. We've got one in person, and then we'll be to the phones. Just a reminder to name, outlet, and if you can also state who your question is for, that would be fantastic.
Thank you. Shailan Skalski with CTV News. This question is for the Minister. I'm just seeking some clarity here regarding the announcement today. So someone seeking information or help could come to a local fire station in and around Edmonton and get information, but you've outlined in this announcement that all that information, from my understanding, is already available online or over the phone. So how will this announcement actually help get more people into treatment?
Well, yeah, I mean, there's some people, some families, are they okay with making phone calls? Are they okay with checking out information online? Yes, but some are not. And sometimes, especially when people are going through crisis, just want somebody to talk to. And being able to talk to a trusted person in uniform, somebody that's going to have knowledge on that subject, somebody that's going to be able to help guide them in the right direction, whether it be to the virtual overdose dependency, opioid dependency program, or to Parents Empowering Parents, or some form of recovery, I think is a positive step in the right direction.
Did you have a follow-up?
I do, yes. Just as a follow-up, somewhat unrelated, but I do want to ask you about a new policy that I understand will be coming into effect in the new year, that some advocates are raising concerns about requiring clients at supervised consumption sites to show ID. Now, some advocates are saying this will deter their use, making them less likely to go and use safely. I guess just explain the reasoning for this policy, and are you at all concerned about what advocates are saying?
Sure. Well, first of all, this is something that's currently before the courts. So, as I mentioned last week, it's something I can't really talk about. But what I can say is that this is an illness that requires people to have medical treatment. And I know I had the doctor even last week supplement what I have to say, and I'm sure he's happy to supplement again. But what needs to be very clear to people is that there will not be disruption in services. If you happen to be a person who decides that you do not want to provide any information about who you are, you will not be denied that service. So you will be allowed to use the overdose prevention site or supervised consumption site, whatever you choose to call it, but you will be able to use that site. So, Doctor, I don't know if you want to supplement and explain the medical component of this. Thank you.
Yeah, thanks for the question. As the minister said, no one will be denied service if they're not willing or able to provide information. That being said, in healthcare, we need to know certain information in order to properly see investigations that have been done in the past, look up, for example, past prescriptions or current medications the person's taking, and even to document care. And this is for the protection of the person. So if we don't know who a person is, we're not documenting what we've done for them, and we're not able to look back on that later to make sure that the care they received was safe, compassionate, and appropriate, that raises problems for the actual individual who's receiving care. I'm confident that the vast majority of people who are accessing services are more than happy to disclose who they are and provide the information that, for example, we need that we could look up a person's healthcare information. A person doesn't have to have memorized their healthcare number. And so for the vast majority of people, I suspect that this isn't a major issue for them. In the cases where a person isn't willing or able to provide that information, we certainly are not in the business of turning away people in need who are looking for care.
Thanks, and we'll go to the phones. Operator, can you please put through the first caller?
Thank you, Michelle Belfontaine, CBC.
Oh, hi. This is a question for Mr. Ellis. So the Association of Counseling Therapy of Alberta was set up for the purpose of transitioning to a full professional counsel or full professional college that would regulate counseling therapists, addiction therapists, and child and youth therapists. And there are 1,400 counselors that have already prepaid their membership for the full college, and all the work is done, and all it needs is for Cabinet to proclaim the regulation to bring it into effect. And I asked some questions about this a couple of weeks ago, and I'm still not clear about what the delay is. I wonder if you can explain that to me.
Sure. I've met with them. There is no final decision that has been made. I have asked the department to go back. There has been some concerns raised by some of our Indigenous friends, and I just want to make sure that that any of the consultation regarding our Indigenous communities is met and that they are satisfied. But at this time, they have written a letter to the Premier, and I'm going to be following up with that. So that's kind of where we're at with that.
Thanks, Michelle. Did you have a follow-up?
Yeah, I mean, the ACTA says that there's no intention for Indigenous healing practices to be regulated. I mean, that was raised in a letter that former Health Minister Tyler Shandro sent in September. So if that's the case, then what's the delay?
Well, Michelle, it hasn't been addressed, and there have been Indigenous, look, we're going to do a thorough consultation with our friends in the Indigenous communities, and I don't think there's anybody here that would disagree with that. We want to make sure that we respect them. We want to make sure that they are, on board with this. The letter that I read, I don't know if it's the same letter that you're referring to, is concerning to me. that they do not support this, and that's why I've asked the department to follow up with that organization to find out if things have changed or if they are standing by the letter that they had sent the Premier.
Thanks. Operator, can you please put through the next caller?
Sam Bersato, CJOC.
Good morning. Yeah, another question for the minister this morning. I'm calling from down in Lethbridge, and obviously these sort of supports are needed in Edmonton, but is this something that the province is considering rolling out to other communities in the province as well?
Yeah, we just had a conversation about that prior to this news announcement. I'm very optimistic that this is something that we're going to be rolling out to the remainder of Alberta. We're doing it here in Edmonton first because there's a need all throughout the province, but there certainly is a need here in Alberta, and I'm very excited about the opportunity of doing it in places like Lethbridge and other areas within this province.
Thanks. And did you have a follow-up?
Yeah, just a quick follow-up. Do you have any sort of idea when that might happen for other communities?
No, I'm sorry. I don't know the timeline just yet, but I will just say this. I'm going to have my staff reach out to you, and we might be able to give you a better idea in regards to the timeline in regard to that.
Thanks. And we've got time for one more. Operator, can you please put through the last caller?
Dustin Cook, Post Media.
Thank you. Hi, my question is for Chief Zatilny, actually. Chief Zatilny, I'm wondering, you mentioned overdose responses are up. Can you tell me how you feel this program is going to help firefighters on the ground, and would you like to see further action?
Yeah, thank you for that. When we're looking at this opioid crisis that's happening, and, we have our provincial support right now, and a huge thank you to Minister Ellis and his team for allowing us to be part of this battle on a proactive front. I stand here with our other first responder partners, and those are physicians and are people that are supporting the parents that are going through this. This is a community approach, and this is a community issue, and I think all of us are in this to make sure that we're looking after those, whether they're the most vulnerable or those that are struggling with opioid addictions. And to know that you might not feel comfortable with the technology or looking up or phoning in for something, that you can come down to a fire station and talk to. Our fire stations are safe places, and you can come talk to one of our staff and know that we're open, we're here to help you, and if we can just save one life, this partnership is all worth it. And so we're in this all together as a community to try to battle this opioid crisis that we're facing.
Thanks, Dustin. Did you have a follow-up?
I do, thank you. And this one, maybe for the minister, just trying to understand the program. So this is to go in and receive supports. It's not actually being able to receive the treatment at fire stations, to be able to connect to the necessary treatment. Is that correct? Can you give a bit more details on this program?
Sure. Actually, I would I'm going to defer this to the expert here, which is Dr. Day. So, Doctor, if you would mind explain the process when obviously an individual comes in and how they can get the treatment. Thank you.
Yeah, so thanks for the question. I think this is important for the public to understand that our objective at the virtual opioid dependency program is to allow a person to access an assessment and treatment medications as quickly as possible, so that in that moment of crisis, they're able to start medications and start feeling like themselves as quickly as possible. So if a person were to come into the fire hall here behind us today and were to ask for information and speak with the fire team that's here, or with an EMS team, or with Edmonton Police Services, or with other emergency providers, the objective would be to help them connect with our medical team in order to provide them with an assessment and to secure for that person medication treatment for them starting that same day from the local most appropriate pharmacy. So we don't need to actually build a clinic in every building. We need to use the tools that we have existing in our communities already. And as we do that, we can effectively and efficiently help people get connected with evidence-based care.
Thanks, everyone.